Good morning, good morning, good morning. How's everyone doing? Dr. Rob Kiltz, another awesome day. And let's see if this color of all this stuff is working right, but it's all good. And live today from Florida. We're going to be doing some stuff down in Florida coming up very soon. Excited about that. Let's see. Amount 2016. Hello. M. Mullins. Hello. And a great day. Memorial Day. Obviously, we're always in memory of so many losses in this world and in this fertility journey. It's a hard one for sure. Kristen, Bree, Sydney, hello. How are you guys? Good morning from Washington, Florida today. Getting ready to get our Sarasota office open within hopefully the next 30 to 60 days. Excited about at least starting monitoring and stuff with Dr. Condra. Really great. Thumper, hello. Let's see. Cal Gurley, hello. How are you? Thumper, Georgia. Let's see. Georgie Realtor, hello. Kelly Ballin, hello. How you work with patients from different states. Aziza. Well, everything is virtual today in this world. We've changed the world. Even before COVID, CNY Fertility has been doing virtual. We talk to clients from all around the world. They come to us either in Syracuse, Albany, Buffalo, Colorado Springs, monitoring with your local OBGYNs or a radiology, ultrasonography, and getting blood drawn, and we're able to connect and help you on this journey. It really is kind of an interesting process that's been really working very, very well over the last 20 years plus, almost 25 years now. It really, Renish, hello, how are you doing? Judge Glant, hello, good morning. Elizabeth, meds last night, a little nauseated, so wondering if you have a suggestion. Well, it depends if they're the oral meds or the shots, but some nausea probably isn't so unusual. It may be that you need to just, I always say fasting is the best way to solve all problems in our bodies. And so I do one meal a day, but that might be something. And you might just talk to the nursing team to see exactly what you're taking. That might help a little bit. Ogdensburn, Lindsay, how you doing today? And Samantha and Trish, a pleasure. We're going to be working, again, Dr. Magarelli, Dr. Fink in Colorado, Dr. Corley Luthringer, Faruqi Banerjee, and myself, mostly in Syracuse, but Dr. Condor with some other team members are going to be helping here down in our Sarasota location. So we're really excited about that. And so many things to offer to people. COVID vaccine, I'd say get it before you do a transfer. Weeks before is always best, and that'll help a lot. It's our pleasure, by the way. Immune protocols. If you look on, hold on one second, guys. Always looking for things to share. We have our new, don't forget the family building guide, which is on Amazon. Our family building guide on Amazon. Check it out. It's easy download. You can get a paper copy. It's inexpensive. I think it has a lot to talk about our immune protocols, Kiltz's Keto Lifestyle. And Maria Craig Emmerich and I are coming out with a new book on keto and fertility. So excited about that. Hopefully it'll be out maybe June, July, August at the latest. I'm making a few little corrections. We got a lot of really great stuff, but it really helps so much. All right, Rachel Keys, hello. 17 FSH and AMH play into protocol 30 with an FSH of 10. And let's see, I'm going back to get your AMH. So these are the numbers of AMH and FSH and age are always are markers to kind of help us identify whether or not we should be looking at in higher doses or lower doses. My personal bias lately has been more lower doses. The lower doses, I think, really work well. I do a lot of letrozole 10, gonal-orphalestim 200 with HCG 20 or 150 gonal-orphalestim and Menopur 75. I think it works really well if you have a high AMH or a low AMH. But this is where I think you want to recognize that when we see a high AMH over 5, maybe close to 10, it may indicate more metabolic disorder or polycystic ovarian-like syndromes. Again, metabolic disorder, which I think is a hyperglycemic environment, and it's glucose, which turns out likely to be the damaging component for most of our bodies, unfortunately. So lowering glucose, and that's why I recommend one meal a day at night before you go to bed. If you go to bed in the morning, do it in the morning. And it's the game changer, in my opinion. I've been doing that now I've been doing mostly fasting, one meal a day for 10 years, carnivore keto for 10 years. And it's been the best thing I've ever done personally. 65, I feel the best, but I've seen so much reduction in inflammation, but that'll help get the AMH down, the FSH, the AMH, if it's too high, get it down. If it's too low, it'll bring it up. And it'll help that FSH come down and help the ovarian blood flow. Ovarian and testicular blood flow is critical. And when there's glycation, damage to the microvessels of the body, it causes a tremendous amount of damage. Hey, Cindy Kreider, let's see. Let me get you back up here. Let's see. Abnormal and high Mosaic embryos together. I think you could transfer any embryos. We shouldn't judge them until we see what they become. But I believe that the testing of embryos isn't that accurate. And we have to be open to the fact that we don't know a lot in medicine, and many tests in medicine are highly inaccurate. So that's why I think you could transfer any and all of them. FSH as high as 12, AMH always been greater, and 19 follicles, 34-year-olds, not as accurate as people think. That I think they're just numbers, and we get so fixated on these numbers, we have to be very careful. Prometrium for 2 weeks and started night sweats every night for 5 days. Do you think I should add estrogen before my period starts? I like to do a combination of estrogen and progesterone, but these are all drugs, and drugs all have side effects. But it's not happening naturally, so we're adding these things to try to help. But yeah, I think a little bit I like to do estrase 2 milligrams, prometrium 200 milligrams. Keep the doses lower. You don't need that much. It may be helpful for you for sure. Nepal, one problem when time of ejaculation, that's, let's see here. The time is pain. Don Raj, let's see. Hello to you. When the time of ejaculation at time. So, well, anytime you have pain, there's inflammation, and it's something that I believe is related to some external trauma, infection, inflammation, and the diet is the kicker for all of us. And my belief is, again, back to one meal, high fat, low to no carbs, and again, it's that one meal really is the key. For sex selection, a girl, dream love. Let's see. How many eggs should I hope to start off with? Well, 1 egg, 1 sperm, 1 embryo, but 5 to 10 eggs is a start. But if you only make 2 to 3, I've seen plenty of success. We're doing something to get something. And sometimes if we look too much, we try to figure out, well, that doesn't look good, we shouldn't do it. But it's in the doing that ultimately is in the getting. So you have to be open to that. Right. Even though I'm experiencing my period, yes, to add the estrogen, even though you're getting your period, it may be something that can be helpful. OHSS, Love Atlanta, estradiol was 8,000. I haven't had much pain, but 20 grams of protein a day, almost impossible for me to get to. I'm only 100. Look at, in my opinion, it's still, I don't like to push a bunch of protein. I don't think that's the right way. You have to, it's the fluids to bring back into your body. But if you're building it up in your belly, you might need to be tapped. And so a lot of this is rest and fluids and salts. And I drink mineral water because I think that's the right way. And fatty meat with salt on it, bacon, eggs, butter, beef, ice cream, and salt. Kiltz's baby's diet, which is that still that one meal a day. It's a high fat, low to no carbs. You can have some simple carbs from time to time. I do not recommend adding vegetables and seeds and nuts. I think they're deadly to us. How can I continue? Let's see. I've had with my IUI cycles. Rachel, sorry, I don't understand that. Let's see. My friend has had 10 or more chemical pregnancies in a year. What would you recommend? Kathy de Pasquale. But basically, biochemical pregnancies and infertility, never conceiving or not conceiving, and miscarriages early and late are all related to the same 5 things. Inflammation due to mostly a high carbohydrate, sugar diet. The chemicals and the antigens that come with the food we eat, which is mostly related to high plant-based diet and poorly cooked foods, in my opinion. And then there's always the fermentation in the bowels, and then there's too much exercise. We go for a light walk or a light jog or a light bike ride. You don't want to overheat the body because heat causes inflammation, which can cause the damage. But this is where I think it's important to look at chromosomes for the male and the female, look at genetic screening, lots of things to do, and look at inflammation, what's going on in the bodies. Mini IVF. Tara Lynn, how you doing? I do a lot of mini IVF. I think mini IVF is best. I do not like the birth control pill, by the way. I'm trying to get all my doctors. Dr. Chang, please, no birth control. Estrase Prometrium. It works great with a low dose, 10, 220. It works really fantastic. I've seen it work more and more and more and more. Water, not wine, not beer. Get rid of alcohol, spirits. They're deadly for the human body. They're not good for us. All right. You enjoy them from time to time, but if you have a medical problem or you're infertile, which is a medical problem, then you want to eliminate alcohol altogether, not just moderation. Get rid of it. Let's see. Naive Palma. Can someone skip progesterone shots? You can, as long as your progesterone level is above 10, maybe even better, 20. I use a lot of Prometrium oral or vaginal, endometrium, crenone vaginal, progesterone vaginal suppositories. They're generic. The pharmacy can make them another option for you, for sure. Starting second round of IVF at Albany office, hoping for good eggs at this time. T-Sweet 05. Dr. Grossman, Dr. Ditkoff, awesome and amazing. We're hoping Dr. Montalto is going to be joining us soon. Really have an amazing team. This fertility journey is not perfect. That's one of the challenges. We're all doing our very, very, very best, and you are doing your very best to help make this happen. 8 weeks, 1 day. Devin Lyons, so much success. Keep at it. Don't give up. Have faith, because faith trumps everything. Faith over facts and spirit over science. You have to have and know the possibilities in everything that's going on in your life. They're all perfect. Let's see. Mercedes, how you doing? Chris, let's see. Marrow factor, fertility, really low count, zero morphology, doesn't take supplements, acupuncture, anything else. Okay, guys, look at the new family building guide. Look at Kiltz's Keto Lifestyle. We have a new one coming out. I'm excited about it. I'm doing some editing right now, but look at the most amazing thing I've ever learned, 1 meal a day. It's easy. You and I are all worth the most amazing things you could ever do. Why would you say, I can't do it, it's too hard? Well, you take care of your car, your house, your other things better than you. You and I are all the miracle machines. That's the truth. Take care of you like the most expensive, valuable, irreplaceable entity ever created in the universe. You are that thing. That's the amazing concepts, right? It's crazy. But the more you realize that, the more you are the amazing miracle machine, the more amazing will happen in your body. But guys, molecular fertility supplements, get off the treadmill, the track, slow it down and cool it down. Acupuncture, massage, meditation, and prayer are really the keys. Tap into your spirituality, the belief in the thing you desire as if it already is, and it will be that or better. Don't give it up. And guys, off the treadmill. Carnivore keto is kick-ass, most amazing thing I've ever done. Ribeye steak with butter, fragua, salt, Malden or sea salt. I love it. And remember, it's to me, fiber, fruits, vegetables, seeds, and nuts are the deadliest things we put in our body. They tell us they're healthy. Well, what's the cause of all disease? It may be vegetables, seeds, and nuts. And glucose is the deadliest thing we put in our body, which we do too much of. A little bit from time to time is all right. And first consult in Buffalo, awesome. Chris Ziegler, thank you. Bobby, all the team members and Dr. D'Souza, thank you. We have the most amazing team in Buffalo. We're really excited and grateful to all the amazing hard work they do. Sarasota, let's see, Cattleman Lane, right near Doctor's Hospital, very excited. I'm planning July, August, at least monitoring, doing some surgeries at Doctor's Hospital with Dr. Condrup for endo, fibroids, tubal disease. We're here to help in so many ways. All right. Higher BMI, Morgan. We take care of everyone, by the way, no matter your size, shape, age, weight, gender, description, color, whatever it is, human beings, we're here to take care of you guys. Required doses of stim meds to achieve same effects. I use a lot of low dose in higher BMIs and they do great. I think they work very nicely. Kiltz's keto is a kick-ass and carnivore keto is conception all day long. It doesn't make sense. It didn't to me until I did it personally. And I'm just amazed how well I feel on this crazy new dietary changes. Game changer. Ingleton, Colorado, not getting graded results back. It takes time to get all these results. You guys, if you want results every 5 minutes, then I'm going to have to triple the price. I don't want to do that. It takes time. You have to be patient. Grades, it's like grading a kid in kindergarten. They're not very accurate. You just have to be patient and wait. Next, am I going to add extra charges for every call you make? I'm trying to keep it affordable. My team in the lab needs to focus on what they're doing in the lab. These things will come. You must wait. Sometimes you have to wait until you get your embryos transferred. Sorry about that. I want to be able to get everyone the things right away, but I don't want to raise my prices. I want to keep them affordable. And I'm sorry about that again. All right. Lisa Palmer. How you doing, Lisa? Thanks for checking in. 43 years young. A mini for 43 with recurring losses, waiting to talk over stims with someone, Syracuse. Low dose protocols, Kiltz's keto. Look at the molecular fertility supplements. The ovarian bloom will help a lot. DHEA, vitamin D3, all these things will help a lot. Karen Sidner. There's a lot you can do. Again, back to Family Building Guide on Amazon, right? It's a cheap, inexpensive investment into learning what we're talking about. And look at Kiltz's Keto Lifestyle on Amazon. Also, go to drkiltz.com. There's a lot more in deep in this that you can take care of. Talk to your OBGYN about doing your blood work, chromosome, genetic screening for both of you, semen analysis, HSG, laparoscopy, hysteroscopy for endometriosis. And if you have fibroids, get rid of them. I'm sorry. I think they are a factor that do affect things. Let's see. I am Sherry Yvette. I don't recommend PGS testing for anyone. They would have thrown me away. I would have never gotten into my mom's uterus had they done genetic testing. I don't think it's accurate enough. You want to do it, we'd be glad to. We don't promise you're going to get embryos to biopsy. None of them may be normal because day 5 and 6 and 7 embryos don't always make it to that stage to be biopsy. So I don't generally recommend it. Let's see. Danson for, consultation in August. First not pregnant, now second, and I have a current chemical. Again, look at our family building guide. Take it to your OBGYN or your fertility doctor. Hey, doctor, what about adding immunology? What about adding IVIG, Plaquenil, Neupogen, Prograf, intralipids? What about Kiltz's Keto Lifestyle? Again, I didn't invent any of this stuff. It's been around a lot longer than I have. Now that I'm 29, but there's a lot you can do to reduce inflammation in the miracle machine. 1 meal a day. It doesn't matter if you're a vegan, a vegetarian, a carnivarian. If you're allergic to something you're eating, it causes inflammation internally in our reproductive organs everywhere. And so if you're infertile and you think you're healthy, well, there's something wrong with your health that's causing you to be infertile. It's subtle. It's under the surface. Remember, the tip of the iceberg, there's a big chunk below. It's inflammation. Inflammation is caused by a standard healthy lifestyle diet, 3 to 6 meals a day, deadly. Mostly plant-based diet, deadly. Seeds and nuts, deadly. I know it didn't make sense to me, but I did it myself and I feel better than I've ever felt. Let's see. Sarasota for retrievals, transfers, fall to later in the year, but I'm really working diligently to help make that happen. Very excited about doing this. All right, share. Let's see. Shaylin Joy, hi. Doing keto, intermittent fasting for several years, but I've been diagnosed unexplained. Unexplained infertility is inflammation, by the way. 4th IUI. I'm wondering if I should go straight to IVF, try more IUIs. Let's see. Yeah, listen, get a laparoscopy, hysteroscopy if you haven't done it already. Look really critical at Kiltz's keto, which is to me is carnivore, 1 meal a day, water, get rid of wine and spirits and beer for sure, seeds and nuts, and fake anything is deadly. Laparoscopy, hysteroscopy, I've seen a game changer. And remember, guys, the Kiltz's keto lifestyle is a game changer for your health and wellness. And by the way, ALS, MS, bowel disorders, skin disorders, joint disorders, it doesn't matter the disorder, even hypertension and diabetes is all caused by a healthy lifestyle. 3 to 6 meals a day, deadly. I'm sorry, our healthy, the marketing that we've been taught is mostly wrong, in my opinion. Genetic console condition, which we'd like not to pass on. So we're looking at IVF, test for chromosome abnormalities, ARATH10, yes. So we recommend if you have a genetic disorder, make sure that we're also looking at other chromosomal issues and karyotypic abnormalities. We will do that for sure. Family, Elizabeth, let's see. Here's the family building guide. It's on Amazon, but I think you go to our website and download a copy too. But the digital, but if you want a paper copy, because I like paper, because I like to write all over it. We do IUIs, we do IVF, we do tubal ligation reversals, vasectomy reversals. We do natural cycles, minimal meds. We do high dose meds. We're very open to what you bring to us also. We are reproductive immunology specialists. We look at reproductive immunology. We work with Dr. Vidali, the Braverman Institute, Dr. Kwok Kim. If you're going to one of these experts also, we will work with you and work with them. We do a lot of this without those extra tests because ultimately, if you're infertile and not getting pregnant with natural cycles or IUI, you do IVF. There was no test that said you need IVF. It's the most expensive thing we do in all this process. In my opinion, IVIG, Humira, Plaquenil, Neupogen, lipids, and Kiltz's keto lifestyle is kick-ass amazing. Let's see, Effening, how long after hysteroscopy and DNC can you do a transfer? I'd say the next cycle, 4 to 6 weeks, works very nice. Let's see, do you have to do PhD testing, sex selection? You don't have to do all the extra testing, by the way, for sex selection, but we wind up doing it a lot. Let's see, Kathy, let's see, Zulika, 62, request, can you tell me your preferred protocol for 44, 1.3 and FSH? I do letrozole 10, Gonal 200 or Falstam 200, HCG 20. That's my preferred protocol for almost everyone. Low dose, mini dose works well. If you're not responding to that, go to a standard dose, even some natural doses. So my standard dose is 300. My standard dose is 300, low dose is 200, high dose is 400 to 600 of Gonal-F for Follistim. We'll work with your pharmacy wherever you're coming from, but through Integrity and Metro and Empower Pharmacy, we're getting some really good pricing for you in order to make this much more affordable. Let's see. First two analyses had about 1.1 to 4 sperm found. Third analysis after 3 months of Clomid for low testosterone, he had 38 sperm. Analysis, no sperm found. You have a chance. Okay, so HCG, Kiltz's Keto Lifestyle, 1 meal, high fat, low to no carbs. Get off the treadmill, slow it down, but add the HCG shots and add the Clomid. I think both those, or letrozole, 2.5 plus 200, 250 of HCG, I think works really nice for the guys. And then, yes, do an aspiration of sperm from the testicles or an open biopsy can really help. Birth control to delay period. I like esterase prometrium for delaying a period better than just estrogen alone. I don't like the birth control pill. Please, team, my team, CNY Fertile team, esterase 2 milligrams, prometrium 200 milligrams. It's really a great way to do it. Low risk, and you can even do them both vaginally if you don't want to do them orally. Let's see, Amber Taylor, second hysteroscopy, laparoscopy in April, just waiting on meds. Cycle is supposed to start in 8 days. We are very, very, very busy, as everyone knows. You have to be patient. You can't just say, hey, I want to go right now. Please help us. Just step back a little bit. Sometimes the follow-ups take longer. The time takes a little bit longer. Be patient with the process. I'm really working on adding more team members to help you. The global team, thank you, Donna, Elizabeth, Justine, Meg. I'm not listing. There's so many other people to list in this process that we want to help you get to the next level in this. Zymot device. Sarah Lee, we're adding Zymot. I think we're adding $200 if you want to add the Zymot. It may be another thing for those who have modal sperm to get a better IUI or IVF process, but it is an extra cost for using the Zymot. We do use it, and we recommend it also. The pharmacy will overnight. Laura Dinger, and again, Metro, Integrity, and Empower Pharmacy are 3 top choices in all of this. Erin Boyce, I tend to have a low progesterone other than ketovore. Yes. Well, again, this is where I think, again, slow it down, cool it down. The molecular fertility supplements for men and women are critical, I think. But if you have a low progesterone and you want to add letrozole trigger shot over Clomid trigger shot, letrozole low dose injectables trigger shot can help, but add the vaginal progesterone to all of that. Let's see. That's where, again, it's some stimulation can be very helpful. Donna, the donor team is so amazing. Thank you, Carlos Smith. We have a really amazing donor team. We're working on donor sperm, by the way. CMI Fertility Donor Sperm Bank is coming. The egg bank, really grateful to my team. They're really working diligently to help people from around the globe. Oh, Dr. Verdialis in Atlanta. Thank you for all the amazing stuff you guys are doing. We're really working on our Atlanta, doing blood testing there, adding some frozen transfers coming up later this year. It's going to happen. We are really grateful to everyone. Let's see, how many try of IVF with own eggs before we have donor eggs? T-Sweet 05. 1 to 20. You decide, we don't decide. If you get in the point where like, okay, this isn't happening, I want to move on to donor eggs, do it. You can always go back. This isn't like one way or the highway. Lots of different ways to do this, by the way. Are you guys all doing okay? Thank you for joining me on this beautiful Sunday, Memorial Weekend. I'm taking off tomorrow. Dr. Lutheringer and Condrup are in Syracuse tomorrow. Dr. Corley, I think, is going to try to get to the Maryland game. He deserves it. He's really a big Maryland fan. But we're again, Dr. Condrup is doing an awesome job doing retrievals and transfers with Dr. Lutheringer in Syracuse tomorrow. All right, FET cycle in Buffalo. Third transfer, first FET. Do you see more success with FETs for those failed transfers and chemicals with fresh transfers? But certainly, if you failed with one, the next one, we're hopeful it's going to be successful. Hysteroscopy, laparoscopy for endo inflammation, antimicrobial protocol. I have a great list in here somewhere in the family building guide, and talks about the antimicrobial, the antihistamine protocol, the antimicrobial antihistamine protocol, and the anti-endo protocols, other things to add to the process, which will really be helpful to improve your chance of success. But if fresh didn't work, frozen. ERP, Cooper, ERA, iGenomics, to look at some timing for the environment also, I think, could be very helpful. So ask the team, hey, just tell them, I want to do an antimicrobial. I want to do an antihistamine. I want to do an anti-endo. I would like to get a laparoscopy, hysteroscopy, and talk to your OBGYNs. Your OBGYNs are gynecologists, your fertility specialists. They are that also. We're really working to connect with them, help them do more in this. Oh, Dr. Ivanov in Philadelphia, our Philadelphia office for monitoring. We're going to be doing bloods there, hopefully sometime coming up later this year. Really grateful for Dr. Ivanov, who will be coming up also to get a little bit more experience in the process. IVF, can you do laparoscopy month prior to treatment? Yes, you can. It can be, I've done a laparoscopy the week prior to a retrieval, but or stim starts. I don't recommend it doing the laparoscopy, hysteroscopy with retrieval or within stimulation protocol. Hi, Cowgirly. Let's see. Why do I get hot flashes after eating? I'm 3 days after transfer. My temp is 98. What are you eating? Something you're eating is not good for you. That's my bet is. There's a lot of anti-estrogenic chemicals in plants. They contain estrogen and progesterone, that I think is part of it. It's inflammation. That's what it's likely related to. So something's going on. Likely what's getting into your body. Either you're breathing it, drinking it, eating it, or it's somehow getting through your skin. These no-see-ums get to me in Florida. I don't know if I can take it, but we'll see. Nanu, HCG-LH can be used for wash. Yes. The HCG for trigger, for wash, for stims, and for boosters. That's the beauty of HCG. Has a lot of uses. Plus Neupogen, also another wash protocol, and also sub-Q. And then there's PRP wash, which is an intra-ovarian PRP for those with diminished ovarian reserve. Jennifer Kionis, how are you doing? Good morning to all. And let's see, Heidi Jean, Syracuse coming from Minnesota. Thank you. Unexplained, inflammatory infertility. Nothing's fine, something's wrong. Doing IUI many cycles paused due to cysts from follicles. Cysts are normal. Don't stop. Keep going. Laparoscopy, hysteroscopy for endometriosis. And look at Dr. Kiltz's crazy keto lifestyle. Game changer. That's the one thing I've learned. It really changed for me by going keto. If you failed the first cycle, why it didn't work? Fabs, MSAM. We can't tell. We don't know. There's a lot of maybes, could be. But if it's not working, either keep doing it. But if you keep doing the same thing, it's not working. Yes, insanity. Let's change it up, shift it up, right? This is where Family Building Guide on Amazon. Check it out. It's a click away. It's an inexpensive investment. Oh, and Kiltz's Keto Lifestyle and the Fertile Feast. Lots of great stuff there for you to learn and energize. Change it up is key. But again, all these cysts, I still stimulate, I still transfer, I still retrieve. Cysts are natural in the ovary. And inflammation also will add to more cysts and endometriosis. Reduce LH during stims. Let's see. So this is where estrogen, progesterone, priming, 2 to 4 weeks. Stay on it when you start your stims, then stop them. But you could even stay on estrogen and progesterone through your stims. You do a retrieval and a freeze-all cycle, maybe another way to keep that LH down. But you're falsely going to be measuring some progesterone and estrogen from either the oral or vaginal estrase permetrium. But it's another way, if you're doing a freeze-all cycle, that you actually can reduce some of those numbers. Hello, Nicole Reardon. How you doing? Let's see. Kimberly Weeks, FET Wednesday. See you Wednesday. Let's see. I'm there Thursday, Friday, Saturday. Let's see. I'm there Tuesday, Wednesday, Thursday, Friday, Saturday, and throughout the week after that. Again, everyone's doing an awesome job. And Dr. Faruqi, we're working to get Dr. Faruqi more to our Albany, Syracuse, Buffalo locations to help us out. We're so busy. And also down in Florida, we're seeing so many people from Florida. Our CNY Fertility Florida, Sarasota office, Cattleman Lane, right near Doctor's Hospital. Excited. Should be monitoring within 4 to 8 weeks. And then again, it's going to take us a little bit longer, probably September to December for retrievals and transfers. Sarah Lee, mini IVF someplace else and had 4 out of 7 eggs fertilized. And on day 5, only want 1 morula. Do a day 3. Don't do a blast. I still think mini is great, but if you want to add a little bit extra gonadotropins, it's letrozole 10, 200, 300, or 400 of gonal with HCG 20, 30, or 40 units. It's some game changers, and our global team's amazing. Lots of patience in the process. That's really important for all of us. Oh, and I'm excited to get Dr. Verdialis down to Sarasota also. All right. Can you recommend increased progesterone, luteal phase, add progesterone, and most of all, stop eating the things that actually probably bind and diminish it? Do you Neupogen wash for every transfer? Let's see. I am Sherry Veet. We don't use it. These are all add-ons. You can add on all of this stuff, but you don't have. There's too much sometimes. Way too much. We want to minimize in order to maximize. That's the part that we're working on. Trimming Tracy, day 14, afraid I will ovulate through. Should I be taking Citrotide to delay ovulation? If you're doing a natural cycle of frozen transfers, so it depends on what you're doing in that. Let's see. Good morning, Diva Kiva. Let's see. Some issues, scar tissue and fibroids. Really want to conceive. Believe this is destiny for me to wake up to this. We're here to help you. I talk to your OBGYN. Hysteroscopy, laparoscopy. Get rid of the fibroids. Get rid of the endo. I really believe it helps tremendously. Whatever you're eating, drinking, get rid of drinking calories. All these drinks that have smoothies or shakes or protein, XYZ, fake food, don't eat them, don't drink them. You want to be drinking water, and you want to be eating real food. If you're a vegan, vegetarian, cook the carbs well, add the fat. Vegans, it's coconut oil. For vegetarians, it's butter and cream. Everyone else, go to the lard, the tallow, the ghee, and duck grease. Amazing. But bacon, eggs, butter, beef, ice cream, and salt, baby's diet, Kiltz's baby's diet, a game changer, and 1 meal a day. Scar tissue, Houston, Zalika. Let's keep the energy going there, right? Let's imagine that Houston is on its journey and on its way. All right, fertility for a year, going to be seeing gynecologist Nikki Nils. Again, check out the family building guide and talk to your OBGYN about HSG, semen analysis, chromosome testing, genetic screening for both of you guys. And if it's using donor sperm or donor eggs, make sure those things are screened separately. I think that's important to do. But if you're infertile, there's a health issue going on. Infertility, I call it the canary in the coal mine. Basically, it's the first thing to go. I'm healthy, but I'm infertile. Well, then maybe you're not as healthy as you think you are. And look at our family building guide. Lots of really great stuff. Your OBGYN might like to add that. Also, lots of great stuff in there for them to learn from. 45, been priming for 60 days, but my period is a week late. Don't worry about your period on these priming protocols, everyone. Just get your ultrasound and blood work. I recommend a freeze-all cycle for many of these. And put the embryos away, mini protocols, duo, triple stims, then go ahead and do a transfer. But if you're not getting your period, don't worry about it. Then go ahead and get a baseline, start your stems. You can be on estrogen, progesterone, even in those stems, by the way. That may help keep the LH and FSH lower, help the ovary maybe not stimulate early follicles, and they'll grow a little more symmetrically is another way to do that. Let's see, how are we doing time-wise? 10:40. Beautiful. I'm going to go for a light bike ride just to kind of get out, maybe do some painting and pottery, although I don't have my pottery down in Florida yet. Let's see, adding estrase. And you guys, let's see here, what type of multivitamins? The molecular fertility supplements, we're really working. Because of COVID, we've been short supplies. We're hoping as things open up, we're going to get more supplies, plenty of molecular fertility supplements, plenty of everything that we offer will be in more abundant supply. But everyone, please be patient. The process requires lots and lots of patience, and have faith first in the higher power that you believe in, whether it's a religion or non-religion, atheist, agnostic, spiritualist, whatever it is, have faith. And it's all the possibilities you believe in that make things happen. I'm reading a new book. Let me see if I can find it here. The Art of Possibilities by Rosamund Zander and Benjamin Zander. My good friend, Mark McNacka shared it with me, and it's all about the possibilities, right? Have faith in the possibilities. Visualize a baby and a family you're building, how it happens, allow the universe to bring the energy together, help make it happen. And whether you do an acupuncture, massage, meditation, whatever you're doing, slow it down, cool it down. That's really the key to your joyful life. And remember, dead people have no problems. Live people have problems, but problems are the presence and the possibilities of all the amazing things in your life. Adri Giddy. My dyslexia gets a little bit in these things. 44, taking contraceptions for 7 days before IVF. Estrogen, progesterone, HGH, Omnitol priming, not the birth control pill. Estrase, 2 milligrams per metrum, plus human growth, go right into a stem. You could stay on all of that, do a freeze-all cycle, game changer. Let's see, where are we at? What can cause an allergic reaction after all meds stop? Well, that's, let's see, it depends what meds you're on, but if you're taking steroids, low-dose naltrexone, we do a lot of low-dose naltrexone, anti-inflammatory, naloxone, it reduces inflammation. So it's another one that I highly recommend. And when you withdraw the meds, maybe you're withdrawing some of the anti-inflammatory effects that allow your inflammatory process, which is trying to keep you alive, trying to protect you from all these invaders. Is there any chance of a healthy pregnancy after a 6-week biochemical pregnancy? Crew 55, yes. Never, ever, 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 ever give up. Faith trumps facts, spirit over science, although we interweave them all together. But yes, always continue to visualize the success of a baby in your arms and building your family. Adoption, donor eggs, donor sperm, donor embryos. Humongous ways to make this happen. Recommend ERA before the first IVF. I don't often recommend the ERA before it, but it's just another list of things that you can choose to do, because there are so many things to choose to do in this, right? It's mind-boggling. It seems like there's too many things to do in this process. Let's see, Maria Cruz, do you think an AMH can get pregnant by IVF? 0.03. Answer is yes. How can you change your AMH? You got to reduce inflammation. Number one, Kiltz's Keto Lifestyle. 1 meal at night before you go to bed. And it's water, no wine, no spirits, no beer, get rid of it. And all these crazy getting on the treadmill, get off of it, slow it down. And the ovarian bloom, the DHEA, and molecular fertility supplements, I think will help bring that AMH up, FSH down. I've seen spontaneous pregnancies from that. So it really is changing it up. Ex-baby face, how you doing? IVF success rate, PCOS. Well, it's either 0 or 100. Keep your eye on the prize. It's 100%, right? Now, you can look at SART statistics or CDC statistics to find out the answer. But remember, it can never tell you what your number is. It can only give you a population-based number. It's kind of scary when you look at that stuff, right? But you're not the population. You're an individual, beautiful entity. I always say, I am having a baby. I am XYZ, whatever it is. I am as if it is and believe it is, and it will be that or better. But plenty of women with PCOS have babies naturally, IUI, IVF, many ways. Read our family building guide on Amazon. Check it out. You might find some really helpful hints out there. All right. Fabs, phone consultations since I'm in Florida. I do phone consultations from Florida, from California, from upstate New York, wherever we're at. We'll talk to you, help you get in the mix. But listen, you're in the mix already. All you need to do is watch the lives, go to the family building guide, find some really great stuff. Check out our Fertile Feast book on Amazon, Kiltz's Keto Lifestyle. Oh, and the Fertile Secret. What's the secret? Faith first. Believe as if it is, and it will be that or better. That's the simple concept of this crazy universe. Faith first, and believe it shall be. Let's see, anti-inflammatories on the autoimmune protocol help decrease uterine inflammation for transfer. Erica, Chelsea, yes. So, anti-inflammation, right? Steroids, aspirin, low-dose naltrexone, CBD oil, Kiltz's keto, 1 meal a day, fasting, not intermittently fasting, intermittently feasting. I intermittently eat 1 meal. Well, I'm in Florida, so Tia likes to take me out for a little bit. I did have, I think the cheese shop. It's really good. We have this melted cheese sandwich, and I do from time to time eat bread, but very limited. White bread, sourdough, the best, and lots of butter on it. Let's see. Just call the office again. We are adding more practitioners, more team members to help you in your success. We're training more embryologists. If you have any interest in being an embryologist in Sarasota, we're looking for new embryologists coming on board, both trained and training. Really excited about more affordable, accessible, and integrating Eastern and Western philosophy. Really critical because spirit and science are intertwined. It's a belief system. It's all invented by us. We invent what it is, and it becomes that or better. All right. DHEA level. I don't measure DHEA levels. I just don't. I don't think measuring them tells us whether to be on DHEA or not. So if it's like our multivitamins, we're all taking multivitamins, but did we check all of our vitamin levels? No. And the same thing with adding gonadotropins. Your gonadotropin levels are fine, but we're adding it to help you. I think if you have a low AMH, a high FSH, ovarian reserve, then add it, by the way. Let's see. If it's for just a transfer, I think in general we add DHEA to help the egg production. But if it's just for a transfer, I don't add it at all. And I don't try to lower your DHEA. But I do know this. You're getting all these androgens by eating plants. Plants have androgens in them. How can you tell me the protocol for human growth? How long does it take? Human growth. I do 3 units to 6 units in priming and 6 to 8 units in stem, but 2 to 4 weeks and even up to 3 months of Omnitrope, Serovital, or Omnitrope, which is, again, the pharmaceutical grade. Let's see. Phone consult in Colorado. Awesome. Let's see. La Bellas Della Vida. Hello. Allison Wonderland. Sarasota opening. I say Monday, but I don't know which Monday. But we just literally took the keys, and we have some work to do. Get some scanning, ultrasound machines, some tables, some equipment, and team members. We're already hiring new team members. Really excited about it. We're going to be seeing people from all around the globe in our Sarasota location. So really excited. We need a clinic in Indianapolis. Well, your OBGYNs can help do a tremendous amount of pre and post work with us. Talk to them. You travel to Buffalo or to Colorado or to one of our locations, and we can help make the embryos, transfer the embryos. Maybe the next step is getting them at least doing transfers, a frozen transfer, and ship them the embryos. That may be our next level in all of this. Well, we're going to be working on every state for sure, one way or another. This is our next global vision, affordability and access and the fertility journey for everyone. Remember, though, you may be able to be successful by just learning from what we're sharing. That's really the key to all this. Sarah Lee Ann, how you doing, Louisiana? Miami. Well, that might be sooner than you know. But let's get our Sarasota and Atlanta offices and our Colorado and all of our places really rocking and rolling. Very, very excited. Let's see. Blake, I'm sorry about the loss. Miscarried my first IVF cycle. You can get started really once that HCG drops and you have a cycle or we take a look at it. We're going to help make that happen. Let's see. Lewiston Jen, Toronto. Dr. Faruqi's working on Toronto and Montreal. Really excited about that. Let's see. What do you like the TSH level to be? Molly Bunday. I like it 2.5 or less. If it's in the 2.5 to 3, that's where I think 25 of thyroid, levothyroxine or synthroid. If it's above that, then we'll adjust it individually. And sometimes if it's in the 2.4 level, just add a little bit of 25, maybe good. Let's see. Dr. Cruz said go straight to transfer cycle 5 days after hysteroscopy, DNC. No, that's good. Anna Johansson. Yes, that's good. Go right into it. And has there been success from this type of cycle? Yes. So hysteroscopy, scratch can be very helpful. Yes, indeed. Kidney disease. Alport syndrome, that cause? Well, my bet is it's all related to inflammation. I would bet many of these syndromes and diseases are related to the environment we live in, which we live a high carb, low fat diet. We're eating 3 to 6 meals a day. You may be putting into your body something that your DNA increases your risk for. Change the environment, change the risk. So look at carnivore keto. Kiltz is carnivore keto for fertility. Baby's diet, bacon, eggs, butter, beef, ice cream, and salt. And go to Etsy for Kiltz's cups, by the way. They're really nominal. I'm putting all the proceeds right back in helping people in fertility, in their fertility journey. That's my job, is what can I do to continue to make fertility most affordable? That's it. Let's see. 6 and day. How to Princess. There has been success with day 6 and day 3 embryos all day long. Day 2 embryos, day 3 embryos, day 4 embryos, day 5, day 6, and day 7. We see success with all of those embryos. Do not lose hope, by the way. Always hold faith first. Faith over facts, spirit over science. And remember, it's all made up. It's all invented by us. The brain is the creator of reality. All you need to do is read my book, The Fertile Secret. And The Fertile Secret is simple. When you believe and see the thing you desire as if it already is, it will be that or better all day long. All right. Good morning. Can priming meds affect your cycle? 45-minute priming 6 days while your period is over a week late. Get an ultrasound and blood work. Don't wait for your period. Priming and get your ultrasound and bloods while you're priming. Estrase, prometrium, HGH, get your blood work, ultrasound, start your stims, stop the estrogen, progesterone, or stay on it. I think it really helps. Sick during stims, the flu last time, Allison, well, that's a tough one. Wear your mask and stop going out there and too much, maybe. But my belief is that there's so much inflammation going on in our bodies that we're susceptible to all this inflammation. Let's see. Natet Cater, Vanessa, Kentucky. Hi. Kidney or cervical HGH help with repeated implantation failure. I think I think Omnitrope, Cerevital, all of these things will help, period. So it's not just diminished ovarian egg function, but also Cerevital human growth can be used for guys, molecular fertility, HCG, letrozole, Clomid, and I'm a broken record. Kiltz's Keto Lifestyle for you all day long. Lower dose of meds will decrease pain risk for HSS. Alice in Wonderland. Absolutely. I do a lot of low dose protocols for everyone. Listen, we're not out to get 60 eggs. Even 3 to 5 eggs is beautiful. All you need. Mini IVF, Amanda, Castillo. I love mini protocols. 10, 220. Tell the practitioners, I want to do Kiltz's mini protocol. It's as simple as that. Keep it simple. Lower the dose. Our bodies don't need so much. All these drugs may be harmful to us in the long run. Lower it down, slow it down, and cool it down. Elizabeth Lee, global team rocks. To the global team, to the travel team, to everyone. I love you guys. All right, let's see. I do get a few text messages and questions. Let's see. Would the line on pregnancy tests get darker if it just messed up hormones? High LH and FSH levels can cause a pregnancy test, urine pregnancy test, to be falsely positive. Alexander, Esther Vivier, laparoscopy for endo 3 months ago, and I get a lot of ovarian pain ovulating. This may be where you want to look towards antimicrobial, antihistamine protocol, low-dose naltrexone, Kiltz's Keto Lifestyle. This is a bucket. We fill the bucket up with all sorts of things all day long. Just put it in and put it in, put it in. Drink it. We whether you're smoking it and chewing it, we put it in there. It then finds its way into our bloodstream or lymphatics, but it also causes damage to the bowels, which damage to the bowels and the pelvis damages the prostate, the testicles, the ovaries, the uterus, the tubes, and all of that. So I think those are really big factors. And laparoscopy, if you're having pain, check with one of our practitioners or your practitioner, whoever did the surgery. Might be a mild inflammation infection, add antibiotics, antifungal, and antiviral. Hypertension, IVF. I've had it since age 11, well controlled. You're a carbohydrate eater. Since you were younger than that. Hypertension is caused by vascular inflammation, which damages the vessels. It's caused by a high glucose diet, which is basically a high plant-based diet. You can get rid of it even at your age today, but basically it's a sign of inflammation. Under control, right, the number looks good, but the damage is still happening. That's what I believe. But it's not the blood pressure that causes the problem. It's the inflammation that causes high blood pressure, damage to your fertility, damage to every organ system of your body. That's the craziness. Our body is a miracle machine. Everything you put in it causes damage. We need lots of air, lots of water, a lot of fat, and very little protein and zero carbohydrates ever be consumed in our diet. Zero carbohydrates ever to be consumed in our diet. That is radical. And I know it didn't make sense to me until I personally did it over 10 years ago. And I've never looked back. Amazing. Let's see. Priming meds only for specific cases. I start stims next week. I was told just continue my normal prenatal. You can do, I think adding the priming meds 2 to 4 weeks could be more helpful. Look at the antihistamine, antimicrobial protocol, and the Omnitrope, esterase prometrium for more and more. A lot of this we'll realize. That's why carnivore keto is so amazing. But if you're a vegan vegetarian, remember, cook the carbs well, add the fat, and get rid of all the drinking your calories. When you're drinking calories, you're adding all this inflammatory stuff to your body. And remember, plants are alive. They don't want to die or be eaten, just like you and I don't want to die or be eaten, right? So they've manifested poisons, hormones to create damage and disease and all those herbivores out there. All right. Thank you guys for sharing with me. I'm flying home to Syracuse tomorrow. I'll be back in the office on Tuesday. Grateful to Dr. Lutheringer, Kondrup, and Dr. Corley is amazing. We love Dr. Corley. He's just a gem of a human being, along with all of our staff members, by the way. But I'd like to give him a shout out because he's just working so hard behind the scenes, and we're proud of him. Donor eggs. Let's see. When do you recommend donor eggs? Donor eggs can be recommended right now. All of these things are part of the menu. And again, check out the Family Building Guide, and lots of really great stuff there for everyone. Thank you, everyone, for joining me. I'll see you guys next Sunday. But check out our other lives with all of our other members, and check out Family Building Guide again. Kiltz's Carnivore Keto is kick-ass amazing. But again, vegan vegetarians do it all day long. I love you guys. I'll see you guys next week. Thanks for joining me today.